Okay, great. So thanks again for joining me in this sample episode of the pilot of the Cadre report, all about COVID-19. And I just wanted to thank you, Jonathan Lomitola. By the way, I just have to say I used to work for Sony Music, so I remember Tommy Mottola.
Yeah.
I was thinking to myself, who knows? Maybe you're a distant cousin, even though I know it's just a play on the name. But the thing is that what I wanted to be able to do was thank Homewood Suites for being able to represent itself as a brand within the Hilton family that was looking at the essential worker. I mean, from what I've understood, even the couple days that I've stayed here, both in October and today, I have seen myself get treated as if I'm working with the hospitals, where all I'm really doing is researching with them. But then there is also I see people in the lobby, that obviously are either I don't know if they're traveling from hospitals or if they're nurses or EMTs or things like that. But I gather
All of the
you've been
above.
able. Awesome. So I mean, do you think that that was part of the motivation for starting your Clean Stay program, or is that just Hilton worldwide? Is that something within this hotel only, or is that something within all of the Hilton family?
Oh, no, no, no. That's a Hilton global brand initiative, and it's every brand, every property, and there's so many dimensions of it under the Clean Stay umbrella. This was, I think they came out with this, a couple months into the pandemic, so it must have been, I hate to put a wrong date out there, but I think it was April or May where they
Hmm.
started developing this. So they were very react. They were right there. They reacted quickly, to what the general public needed to feel safe during travel.
Hmm.
Marriott did something with the hydrostatic spray. Every big hotel chain came out with something. I thought Marriott's was cool because they incorporated the hydrostatic sprayer in the rooms. Hilton took a grander approach, and they said, listen, we're going to focus on the high contact. This is a viral disease that's transmitted, person to person contact and surface areas. So we're gonna explain how we're gonna clean the rooms, not just everybody saying, oh, we're gonna do a deeper clean and better chemicals. We're gonna say that here we're gonna hit these top 10 touch points in the room extra, and
Right.
that was one thing under the umbrella. Some of the other things were new chemicals. Some of the other things were having sanitizing wipes in the public areas required. Another branch of it that's also under the Clean State Initiative is regardless of municipal mandate, everybody wears a mask, guest and
Yes.
associate, in the
Yes.
public. I thought that was nice. Things like that. These are all sanitizer stations in the hotel. Social distance, signage, limited capacity in business centers, fitness centers, things like that. We revamped our breakfast to
Yes.
make it less touching less things, as with the different floor markers. So all those things were under the Clean Stay umbrella, and they released it for all the brands. But it's
Right.
nice. It does give enough leeway. It does give enough leeway for the individual hotels to cater it to their needs in their high traffic areas and their
Right.
areas of focus. So I thought that was interesting.
What did you? Are you saying therefore that Homewood Suites Times Square is currently what 80% essential workers, basically, or 50%, or what would you say has been your volume of traffic during the pandemic?
Well, it's been fluctuating. In the early stages, uh, when hospital capacity was an issue, um, we were well over 50%. In the early stages, April, May. If you
Yes.
remember, when they converted the Javits into a hospital, that was actually we housed that Naval Reserve, regiment that set that up, and we also had
Wow.
the New York State Fire, a lot of first responders because there was an extensive renovation to the ventilation, and as you can imagine, you can't
Yes.
set up a field hospital, inside on the spot without critical ventilation. So the fire, New York State Fire Department was there for them. All those people were staying at the hotel, so we were well
Amazing.
over 50% at that point. And it
Because the
went through
Javits
different
Center is only
stages.
2 blocks away from here.
That's correct. Yeah, and there's a lot
Interesting.
of hotels in that vicinity. To be honest with you, but I thought that we kind of always had the edge. This might have been one of your other questions. What attracts people to feel safe
Right.
here? If you're a nurse, if you're a health aide or a first responder that's traveling from, we had people from Texas, California, Utah, all different states. We were taking people from everywhere because the government, New York State needed them. So they put out the call for them, and we were
Right.
on the list to provide the housing. I think one of the things that there are a few things, but one of the main things is that we are an extended stay property. So
Yes.
for us to transform, we already take care of healthcare workers. That's one of the niches of extended stay business is
Right.
healthcare and hospitals, and things like that. So we have the kitchens in the rooms. We have in Midtown Manhattan, you can get a 400 square foot studio. It's like having your own apartment with a
Right.
larger refrigerator, toaster oven, things like that you don't normally get. We also have, you know, no one likes to walk outside, now, especially with the way, unfortunately, the city has somewhat deteriorated. I hate to say it, but it's the truth. If you
Yeah.
walk outside, people like
Yes.
their own space. We have two private outdoor spaces here. I'm sure you've been up to the rooftop to check it out.
Yes.
So,
Yes.
so that's one of them. It could be a little sanctuary and people feel safe. And then the public areas, while we have to follow the guidelines, now we're back to no indoor dining again. We're back to that, but at least we can still have a hotel where the public areas are open,
Right.
regularly sanitized. We have the wipes available.
Yes.
And as long as social distance is observed, we don't mind. People can still sit in a hotel public area and feel safe. You know.
Correct. Correct. And I mean, I see all the Lysol wipes around, and even just the fact that when you have your laundry room and your gym nearby, I can see that this place has become less of a hotel and more of almost like not the Hilton Club or Hilton Grand Vacations, but it has become more like a home. And I think it incentivizes, like what I was telling you, what I want to do with Hilton Grand Vacations going forward. But maybe it should be a new subcategory. You've got your retirees and you've got your essential workers and people who are COVID-19 survivors or maybe unfortunately became displaced from their homes but now have a place to go.
Yeah.
So there's so many opportunities out of it. Unfortunately, at the misfortune of what the pandemic has created, but I can see how Homewood Suites, just like I presume Embassy Suites, the suite element of it makes it for the purpose of not just tourism, it's for the purpose of living somewhere, and Hilton trying to do what it can to protect people, especially during hard times like this.
Yeah. Absolutely. I think that's what they were thinking when they tried to formulate that extended stay strategy. And you do have the embassy suites as well as the home two suites, which is another
Right,
Hilton brand. We're more of a fuller living area,
right.
and we offer the hot breakfast, and we actually have kitchens in the rooms, whereas the home two is more
Yes,
of a wet bar setup with a door partition. But still, like you said, the different niches, and we're happy to provide that place in the market. I mean, we, we,
yes,
we were very, definitely a lot of hotels closed. A lot of hotels found another niche where they could provide housing to the government,
right.
whether that be, COVID recovering patients or the homeless, the people that they're out of work and don't have a shelter, to depopulate those.
Yes,
And we are very happy to find our niche, with these with the extended stay, everywhere from the first responders to the visiting nurses, and it was a good feeling. For a while we even had signage up just saying thank you. We thought it was cool, just getting everybody's story where they're from, and a lot of the
yes,
staff became quite close. You see the same people every day for towels, for sheets, talking to them. We seen them come back, seen them come back in the morning from an overnight shift, and I don't even
yes.
know how they kept their smiles because I would just imagine what they lived through.
Yeah, I can
Yeah,
imagine. And
yeah,
I'm sure that probably in every city, unlike New York, Homewood Suites in particular has had the same type of response, but it had varied depending upon how critical their area was in terms of people who were infected or if there was like no hospital beds anywhere or things like that, correct? I mean,
yeah.
is New York City therefore like the prototype of how other Homewood Suites across the country have been responding to this crisis?
It's funny that you said that. I mean, yes and no. It's a flattering thing to think about. I'm proud to set the example. I don't really want to be anybody to be in the situation that we were in April
Right.
and May. I mean, it was very,
Exactly.
very desperate. Yeah. So, but yeah,
I'm
some
worried about
cities were.
January based on everything I'm seeing here. What happened in the last month?
Sure, sure. Yeah,
No.
with second, third wave, the new strands. I mean, it's what you hear. But yeah, the cities and townships and areas, geographical areas that were in this type of situation where they had huge spikes, then I would say that yeah, I think they would have followed our guidance. I could tell you some of the, and I apologize if I'm answering any of your future questions by answering them now.
Right.
Um, that's all the better. But while it's on my head, one of the things that we did here is with all the staff, every member of my team. Of course, I mean usually they have their own living accommodations, but everybody has a studio in the Homewood Suites here. Everybody's living on premise
Yes.
for a couple reasons. More eyes and ears on property. It helps out their families. It helps them quarantine when they have to. If they want to stay away from their family, they can. They can
Yes.
distance. They have a place to come before and after work. They have a place to change, feel safe, go to the bathroom. And we haven't had any issues here with losing employees because of the virus or any kind of massive contact tracing where we had to take people out of the game for a while, where we wouldn't be
Right.
able to operate the hotel. And I think that's why. I think that's why, because that's the big reason why, because all the staff is living here. So when people come in once in a while, we don't deliver on something and someone will have some feedback for us, so we could have done better. And I tell them, I said, thank you for the feedback. The one thing I can tell you, sir or ma'am, is that it's by no lack of effort, because everything you're getting
Right.
here, we're also utilizing these services. We're right there
Yes.
with you. So we want the hotel to be clean. We want the hotel to be, disinfected. We want the hotel to operate properly, to everybody to observe the mask and the social distance things we have
Right.
in place. Sometimes they don't, and the other guests get mad at us. We have to step in. It's up, but the point there is, we're all kind of one with you guys. We're all in the same playing field, and I think once they hear that, they feel real safe. We closed a lot of deals that way. We tell the extended stay people that hey, we can tell you firsthand that we feel safe. I've been living here since March. I mean, I go home on the weekends to my family in Long Island. But yeah, I've
Wow.
been here since March, and there was a period of about 3 or 4 months, where I didn't go home at all. And a
It's
lot of people
incredible.
were in
That
that same
really is
boat.
saying that the hospitality industry is becoming an essential worker class of its own. Wouldn't you agree?
Yeah, absolutely. And I feel sad when I hear that. I understand the reason for it. They have to have some classifications deemed a certain way, but the whole thing about some jobs being essential, some not. I have a lot of small business owner friends that have that are on their way to losing everything. Because they can't operate their businesses. So
Yeah.
it's tough. I don't know the answer. It's just these things are not easy. Hopefully we get them some relief in one way or the other, like we did a few months earlier.
Right.
But
Right.
so you always look at the big picture, and you always say, so that's why when people say, oh, they start, the guests are very proud of us. They say, it's heroic that you're here. It's like it's not though. We're thankful to have a living. We're doing what we need to do. We're keeping people safe. We're doing our best, but we're
Hmm.
doing what anybody else would be doing in the same situation. We're just happy we can provide for our family, to take care of other people. As I mean, if you want to throw the hero word around, you got to be talking about the medical people that are doing this.
Oh, yeah, absolutely. I mean, the funny part is, I read all about Conrad Hilton's original building of the Hilton properties down in New York in the 1920s, 30s, 40s, and even when I did orientation back in 2016, and they talked about how he bought those hotels in Texas, and his main concern was the Hilton family legacy of giving back to society. I think that what's ironic is COVID just was the transparent vehicle to relive Conrad's vision. And I think that in itself, I mean, I'm a brand loyalist. I consider myself to be. I mean, I have family that work for the Marriott, but just because they're family doesn't mean I'm going to use Marriott. I already know the Hilton experience, so I know Hilton is where I'm going to have, for example, my family reunion at the Waldorf when it reopens next year, or
Nice.
probably even the Beverly Hilton. They've treated me like gold because when I worked in the music industry, they thought I was with the Academy, which I was not. but they
Wow.
still get the penthouse and presidential suite to stay whenever I was there for the Emmy Awards or Oscars or stuff like that. So it's just that I feel that sense of family that the Hilton name and the legacy is carrying, and I can see. I mean, when I was impressed with how Kevin was treating me and Jose Dennis, who's staying with me now, just because he's working for the DOE. And I was like, that's even more than I could have imagined, because at the time when I was staying here, I was already planning on my March presentation with Hilton Grand Vacations, but just for, again, the timeshare business, the Hilton Club business. Nothing to do with COVID, but that completely, this whole experience has made me pivot my business strategy and my life strategy in terms of how to appreciate the hospitality industry. I mean,
Yeah.
you must be already in line for the vaccine distribution plans that are going to be coming out in January and February, correct?
Um, to be honest with you, no. I mean, I'm all for taking it, but I feel, I honestly feel completely safe every day. I don't feel nervous. I made it a
Okay.
point to build up my immune system, follow the science. I've been, away from, except my household. It's my family. Seeing my family's been limited. We use a lot of FaceTime, so I'm fine with letting it go through all the other channels. I don't need to jump in front. I feel completely safe. I'm surprised. As of 2 months ago, I don't have the antibodies. I'm shocked that I don't have them. I probably do by now. Who knows?
Oh,
But
well, I can tell you, I mean, there's so many different versions of spread, obviously. Me, I had
sure.
mild symptoms, so I was receiving it from someone who was the first target. I
Sure.
wasn't outside in this situation. He still has his antibodies to this day. Mine
Wow.
dissipated in November. So that can show you,
Interesting.
if you were asymptomatic, your antibodies are gone like that. So it's a
Wow.
matter of a sliding scale, I guess, depending upon how severe you were infected or impacted by
Yeah.
it. Now, I gather if you say you don't have antibodies, does that mean you were infected at one point and you just go for it? Is that what you're saying?
No, no, I never had it. I just thought I might. I just thought I might have along the way start to build up my own antibodies just from, I don't know, just being in this public area in the epicenter of the virus. But I didn't, as of 2 months ago, I was negative for that
Yeah.
serological test. I haven't
No,
been
I
since.
mean, basically, you would have had to definitely been infected with COVID-19 to start generating them. And I guess that's the difference with the vaccine. It gives you
Gotcha.
the antibodies without having been infected.
Yeah,
But
so I think it's wonderful what they've done. I'd love to take it. I'd be willing to take it, but I guess I'll know when it's my time. For right now, I'd love to see its way to make it through all the emergency workers and first responders and the elderly and things like that.
yes, definitely.
Before they need to give
Definitely.
it to me, because I know that I'm not worried if I get sick. I mean, I feel like I don't have any pre-existing conditions. I would just make it a point not to spread it, but I wouldn't be scared of it or anything like that. I think
No,
that's if
yeah,
if anything else, what we've learned. I mean, so much data now on the virus is I mean, if you don't fall into that category, certainly follow all the guidelines, but maybe you don't have to live in fear. You can actually still be a productive person, go out and contribute and then let someone else get your vaccine so they do it quicker, and then everybody just, it's pretty straightforward. You do the right thing.
right.
You test yourself if you have access to testing, which everybody
Yeah,
should by now. I
yes.
try to test. I try to test monthly just to make my wife and kids feel better.
Yeah, exactly, exactly. But and of course, I know like Jose, for example, he tests weekly because he has to, and now
Yeah,
he's working from home again. But the thing is, like what I was telling Kevin back in October, is that if he had to find a place to work every day, and it was not in that area, maybe to actually be housed here when the new semester starts in January. I guess we'll find out more information,
yeah.
and of course, I'll contact Kevin if we want to actually have him relocate here for a longer period of time. But I know
Yeah,
if anything,
please do, because that's what Kevin's there for. He'd be happy to help you. Sure.
yes. And so basically, overall, I would say that the next stage that Homewood Suites is going to start engaging in is that anybody who is in line for the antibodies between now and February, let's say, especially when they go fire and EMS and police and other essential workers that are starting to get Moderna, by the way, the Italian one. New York
Yeah.
company, an Italian name, a little bit of a plug there. The thing is that that's the one I'm trying to get because of the fact that I'm taking care of my father. I'm trying to get him on the front of the list because his infection is starting to rise again. I am going to therefore since I'm living with him and my mother, get us all vaccinated in that group based on his treatment meetings that he has in the next coming weeks. And so I would like to participate in that just to continue the research and the experience of what it's like to take those vaccines, because I know there's so many people with so many different stories based on what kind of communication they've gotten,
Yeah.
All right, so I'm going to stop this and then continue our conversation, but you pretty much have given me the rundown. Essential workers, what it was like during the pandemic with what you did at the Javits Center, going into what the hotel brand and the legacy of Conrad Hilton, going to the vaccine. So that gives me a good synopsis for when I start presenting this in a few weeks.
Great.
So thank you again, Mr. Lomitola, for joining us in the first episode of the Cadre Report.